first speaker is Dr. Juhy. Dr. Juhy is an associate consultant at Girdhar Eye Institute. She completed her medical retina fellowship from the same place. She's also a young and keen researcher with a few publications under her belt. Dr. Juhy.
Thank you, ma'am. Thank you for this wonderful opportunity. So I'll be just talking about the protocol and study design of Smart India study. So as we know, the number of diabetics in India is on its rise. 77 million documented in 2019. It is predicted to increase to 135 million by 2045. With such high number of diabetic patients, it's difficult to screen each person individually for the complication of diabetes like diabetic retinopathy. So what we need is a risk-based strategy or a screening pathway which will help us to identify those people who are at risk of visual impairment due to diabetes. Smart India study is a multi-center effort to actually deal with this particular problem. So Smart India study was part of the Ornate India project, which is a UK-India research collaboration, which is funded by UK Research Innovation and GCRF, that is a Global Challenge Research Fund. Global Challenge Research Fund was started by UK government in 2015 with the primary aim of dealing with global challenges across low and middle income countries. So the main aim was to build research capacity and capability in India and UK to tackle global burden of diabetes-related visual impairment. It was a multidisciplinary, multifaceted UK-India study, which was led mainly by Dr. Shobha, who's a retina consultant professor from Moorfields Eye Hospital, and the team had ophthalmologists, diabetologists, public health experts, primary care physicians, research scientists, biostatisticians, computer engineers, both in UK and as well as in India. So to make it or to deal with all aspects of diabetic retinopathy care, Ornate India project had divided it into 5 integrated work packages. And the work package 1 was the Kerala Nayanamritam study and the Smart India study, which dealt with evaluation of screening models for diabetes, pre-diabetes and diabetic retinopathy. And other work packages included utilization of AI in retinal image grading, using biomarkers in identifying sight-threatening diabetic retinopathy, health economics and risk modeling. So Smart India study was put forward to translate research evidence into clinical and community practice. The primary objective was to determine ideal test that could identify people at risk of diabetes. Second was to evaluate if an initial triaging with non-lab diabetic risk score, which is more effective than using directly the conventional lab test. And third was to develop an affordable, easily deliverable and clinically effective model to identify people at risk of complications. Other objectives included to build future policies on screening of diabetes, to identify the regional prevalence, and to find out the accuracy of AI in diabetic retinopathy grading. It was a multi-center cross-sectional study which was conducted between November 2018 to March 2020. It recruited participants from community-based screening so that it can accurately identify people who are at risk of diabetes and pre-diabetes. So it covered around 20 sites across 10 Indian states and 1 union territory, and each region was again divided into 3 categories, so 3 clusters: urban, rural and a special category, so that it will give broader representation. The special category was a group of people who had limited access to healthcare or who were considered to have low or high risk of diabetes. If you see the map, you can see most of the centers were in South India, and this was because of the increased prevalence of diabetes in South India. The study was performed as a door-to-door survey with questionnaires and point-of-care test performed by field workers. Stratified sampling was done using data from 2011 census, a census enumeration block covering 125 to 150 households in urban area, and villages or rural area covering approximately 300 households. Each household was approached, and inclusion criteria was adults who are 40 years or older of Indian origin, and vulnerable population, those who are currently participating in other studies, or people with type 1 or secondary diabetes were eliminated from the study. So as we said, it was a questionnaire-based study which was done by field workers. They approached the household, obtained informed consent, unique patient ID was given to each participant, and a detailed questionnaire was given which included demographics, brief history, anthropometric measurements, socioeconomic status, and other parameters. And the people were divided into two groups. One was already known diabetics and the other where diabetic status was unknown. In diabetic status unknown category, if HbA1c was more than 6, RBS was more than 160 and 50 participants per cluster of RBS between 110 and 159 were subjected to further test. The further test includes lipid profile, microalbuminuria, non-mydriatic ocular examination including visual acuity, non-mydriatic fundus photography using a retinal camera was also taken. And the fundus images obtained were actually uploaded into a teleophthalmology cloud drive, which were then graded by a primary grader from the local center and a secondary grader from another center. And if there was any disparity between these two, it was also consulted by a senior retina consultant from the second center. It was the responsibility of the local center to identify the grade of diabetic retinopathy and give them adequate referrals. Like if it was a sight-threatening diabetic retinopathy, it were referred to eye hospitals. Non-sight-threatening diabetic retinopathy was asked to visit the retina consultant after a year, or no diabetic retinopathy, no further action was necessary. So to conclude, Smart India study is the first population-based prospective study with pan-India representation. Risk-stratified, resource-efficient screening models are given by this study, which will help implement targeted screening or targeted interventions in people with diabetes. This will help us to identify diabetic complication and to mitigate blindness due to diabetes in India. Thank you.